Good afternoon, everyone. Thank you guys for joining us. I am Ashley Watts, President and CEO of the Kentucky Chamber of Commerce, and we're excited to have this webinar today. I know many of you all have joined us for our previous webinars. We are trying to do about 2 a week, and we've had a really great response. We would like to thank our partner in this endeavor, the Community and Technical College System here in Kentucky, KCTCS, for helping us. This webinar I have been really excited about because it's with some of my counterparts from across the reopening and how Kentucky is doing it in phases. We know that our first reopening date is May 11th, so we're all excited about that. But really, we've learned from states around us, our surrounding states. And so we do know that some states are moving a little quicker than we are. And so I think it's important for us to learn what other states are doing, the ramifications of that. Have cases gone up as they've reopened? And so I've called on some of my friends in the chamber world to kind of talk about how their state are doing with the reopening. So we're going to open up the conversation with that, and then we're going to shift in the later part of the conversation later on in the hour to Jim Alsop with Brown-Forman, one of our member companies here at the Kentucky Chamber. And Brown-Forman, as we know, is a global company. And so I think it's important when we talk about reopening is that some parts of the world have already done this. They've already tackled some of this, and they've put into these policies and procedures that we're now kind of going through here in Kentucky. And so we're going to learn a little bit from Jim about how Brown-Forman has been able to kind of this new reality of which we are all living and make sure they can still get their product out, which is obviously very important, especially when many of us are quarantined. Nice to have some bourbon at our disposal, but also, of course, making sure that their employees remain as safe as possible. So thank you all. I'm going to introduce the panel. We have with us today, I'm going to try to go in the order I see it on my screen. We have Keith Lake with the Ohio Chamber of Commerce, and Keith is the VP of Government Affairs. We have Kevin Brinegar from the Indiana Chamber of Commerce. He is President and CEO. We have Chris Clark with the Georgia Chamber of Commerce, and he is President and CEO. We have Bradley Jackson from the Tennessee Chamber of Commerce, and he is President and CEO. And then we have Jim Alsop from Brown-Forman. So welcome. Thank you all for joining us this afternoon.
Okay.
Great. I think we're going to do a little bit kind of just round robin way. And I think I'm going to start with Chris first. So a couple weeks ago, I know many of us watched the news, and Chris, I think I saw you on a couple national news podcasts talking about the reopening of Georgia's economy and of Georgia's business. And it was kind of a joke that even massage parlors were going to open up. But I do think it's been very interesting to see how Georgia has reopened their economy a little faster than maybe some of our states. And so really, I just kind of want to open it up with saying, how has the reopening gone? What businesses have reopened? Have there been some that maybe haven't reopened at full capacity? Just tell us a little bit about kind of the landscape of your all's reopening right now.
Sure, Ashley, thanks for having me. And I think to understand where we are now, we have to look at what we had we really had 3 categories in Georgia. You had our critical industry sector who, they continue to operate. They just followed CDC guidelines. So we joked that their dimmer switch was turned down just a couple notches. Then you had about 20,000 businesses that were restaurants, high contact, the massage parlors, the barbershops. They were completely closed down. So they were turned all the way to zero. They couldn't operate at all. But every other business in Georgia during this downtime was allowed to follow minimum basic operations. So we had 20 guidelines. If we followed them, we could continue to operate. And so the vast majority of our businesses in Georgia continued some type of operations. What the governor did is open back up about 20,000 businesses. So everything in Georgia now, except for nightclubs, bars, and entertainment venues, can operate as long as they follow guidelines. And so if you're in Georgia, there are 20 guidelines to follow. If you're a restaurant, there are 39 guidelines. If you're in the cosmetology sector, there are about 25 guidelines to follow. And what we're seeing are most of those businesses are opening or starting a slow process of reopening. You do have some that that's a small rate of current businesses. So that's kind of where we are. Where we are today is you've only got a few of those business sectors that are unable to reopen right now.
Great, thanks, Chris. And the other gentlemen are our border states. And so I know we have heard from many of our cities that are on the borders about how the openings in other states have gone. So let's start, Bradley, let's start with you in Tennessee. I was talking to a chamber yesterday that's kind of on the border of Tennessee, and there, there's obviously a little bit of frustration that some businesses right across the border can open and they can't. And what will that mean on the impact of their businesses? So tell us a little bit about Tennessee's reopening, kind of how it's going so far.
Sure. Governor Bill Lee here, he, like many states, he appointed an economic recovery group, and the state chamber and a number of other business trade associations were on that group. He appointed that group after announcing that Tennessee would open up on May the 1st timeframe. So his initial action was by looking at the numbers that Tennessee had, and our numbers, now that we have opened up, probably not as quickly as Georgia has, but our total positive tested cases are right at 13,000, I believe. So there's not been a substantial uptick. So restaurants and retailers opened really last week with capacity limits. They can have 50% of their total fire code capacity. So they've done that. Tennessee, the trends, they've implemented a lot of testing. So anybody in Tennessee who wants to be tested, even if they're asymptomatic, can do so. We've tried to make sure we have good data to determine, what are happening to cases. How are they increasing? I will say Tennessee is a little bit different. We have a total of 95 counties here, and the governor's opening status has applied only to 89 of them. Because a number of years ago, and you all are probably facing this, our state statute is in no way prepared for a pandemic. So there's been a lot of confusion. So the 6 urban counties are still, they have not initiated any of their phases to open because the mayors there have the authority to not allow those businesses to open. So you can imagine the frustration, across county lines, that some are open, operating, and some are not. So we feel good about the return. We think this is a good position that chambers and industry can say, while we were operating during this essential time, which our governor, similar to a number of you all, defined us as all manufacturers as critical industry. The work that we've been doing has made sure to keep our employees and customers safe. We've not seen a substantial uptick in cases. I will say Tennessee, the one thing, when you look at the CDC guidelines, I think it's pretty clear that there will not be any major, kind of event openings, because when you look at kind of where the disease can spread quickly, that one is still off the table here.
Great, thanks, Bradley. Kevin, Indiana, I know Louisville has questioned quite a bit about, trying to have some being in sync with the opening of Indiana, because as you know, live and work right across the river from each other. And so I think there is a little bit of concern that Indiana is moving a little faster than Kentucky, and making sure that Louisville can kind of keep up with that. And so tell us a little bit, our neighbor to the north in Indiana, how the opening is going. Are you doing a phased in approach? That's one thing I'm kind of Kentucky's very much doing kind of a 3 phased in approach right now. So tell us a little bit about Indiana's opening.
Well, the governor, Governor Holcomb, announced his plan for reopening the economy last Friday. Up till now, there has been executive orders outlining essential businesses that could remain open during this time, non-essential, and that included retailers and grocery stores that were providing food items, and pharmacies, but then other retailers could not have customers in their stores. They could only do delivery or curbside. Our governor has put forth a 5-phase plan that starts next Monday with additional businesses being allowed to be open. We have, as Bradley mentioned, we have 3 counties that are not going to be on the same path because they have high numbers of cases of COVID, and they've had some stress on the healthcare system. That includes Marion County, which is Indianapolis. It includes Lake County, which is in northwest Indiana, right near Chicago. And then we have a rural county in northern Indiana where there's a Tyson pork processing plant that has had over 1,000 cases just out of that one facility. So that county is kind of on the bad list and has to wait. His plan goes through all the way through the 4th of July, when, as envisioned, everything would open up, including conventions and sporting events. It is probably no coincidence, rather, that that 4th of July weekend happens to also be when the Brickyard 400 is scheduled to be run at the Indianapolis Motor Speedway. The Indianapolis 500 has been moved to August, which will be the first time since World War II it hasn't occurred during Memorial Day weekend. And that is, if you're not familiar, it's the largest single-day sporting event in the world each year, with about 400,000 people in the stands. So that's how we've been doing it. The governor has also appointed an economic recovery task force of 5 individuals to work with his Secretary of Commerce and his OMB director. We're very blessed that 3 of those 5 members are board members of our chamber. Another one is just a recently retired state senator who is a good friend of mine. I go to church with. He was my state senator, and then a former lieutenant governor under Mitch Daniels, who's a friend and ally of ours. So I've been pumping them information since the day they were announced about priorities and ideas, some of the things that we've gathered from the U.S. Chamber and our Council of State Chambers group as well. So we are on our way. It's a fairly detailed plan, but there are initial restrictions on restaurant capacities and things of that nature, and then it builds out. And he was very clear to say that that these timelines could be changed based on what the numbers are doing in our state. And so this is a fluid, flexible kind of plan.
Great, thanks, Kevin. Keith, I'm going to turn it over to you. In Ohio, kind of similar to Kevin with Louisville, we have Northern Kentucky that obviously borders right on Cincinnati, and you can actually walk the bridge over there, and we have a lot of people that live or work on one side or the other, and so our openings are a little different. I do think, though, of all of our kind of surrounding states here in Kentucky, we have probably followed Ohio the most closest. So tell us a little bit about Ohio's reopening, kind of what phase you're in right now.
Well, thanks, Ashley. It's a little hard to say what phase we're in. So let me just back up a little bit. We've been under a stay-at-home order here in Ohio since midnight on March 23rd. And some of our businesses, the high-contact businesses, restaurants and bars and beauty salons and so forth, probably about a week earlier, they were closed down, a week ago, earlier than that. The good news is that we've been working with our governor, Governor Mike DeWine, here pretty closely, and had a lot of input into the original stay-at-home order and encouraged lots of flexibility on the state's behalf relative to who they would define as essential under the order and thus able to continue operating. So we've actually had a lot of our members and a lot of businesses in Ohio, even under the stay-at-home, that have been operating throughout. But effective last Friday, we began a reopening of the rest of the economy. Began last Friday with the restart of our medical facilities to do non-urgent surgeries and procedures and other healthcare services. And then on Saturday, retail establishments that weren't already allowed to be open were allowed to begin offering curbside pickup, and then stores that restricted their operations to 10 customers or fewer were allowed to do an appointment-only basis. And then on Monday of this week, a much broader reopening occurred where manufacturers, distributors in the construction industry, along with just general office environments, were allowed to reopen as well. And then on Tuesday, the rest of our retail industry will be allowed to open. Now, what that leaves is the dine-in eating establishments and bars, the beauty salons and so forth, along with the entertainment industry. And as we speak, our governor is doing his daily press briefing today, where he is announcing the details of when the restaurants and the beauty salons and so forth can open as well. So that information is coming. I don't know the details exactly, but we're expecting that they're going to be allowed to open with some restrictions, restrictions like capacity and so forth, probably late next week, another week from now. So as of today, or as of Monday, when our retail establishments open, that's probably about 85 to 90% of all businesses will be open by then. And then when the restaurants and others open up, maybe a week or so later, we'll be pretty close to everybody will be open, other than the movie theaters, gyms, and larger venues like that.
That's great. Yeah, we do have beauty salons on our list at the end of May, and I know all of us are very excited to see that. One thing that I have been kind of researching, and I've looked at your all states, what we are doing right now in Kentucky is really looking at sector-specific requirements for reopening. And so we've been working very closely with the governor's office, and we've submitted recommendations on how these sectors can reopen in a responsible way and also get back up and running fairly quickly. So we know kind of masks are kind of typical across the board. We have talked about temperature checks. I think now here in Kentucky, they could do temperature checks at home and maybe report that somehow. But I've looked at your all's states, and most of them have kind of best practices plus also minimum requirements. So Chris, for the manufacturers or the businesses kind of in Georgia that are up and running, how strict are the requirements, or is there some flexibility for basically businesses to make sure they keep their employees safe, just kind of on their own? There's some flexibility, because right now in Kentucky we're dealing with pretty strict requirements, and we're trying to see what flexibility we could give to employers.
So it's fairly strict for those 20 minimum operating procedures. I mean, it's the social distancing, the 6 feet. Certain industry sectors are suggested masks. I think some are required to do masks. Tell you the problematic. You've actually seen fights and arguments at different stores because some people aren't wearing them and they're asked to wear them. And it's there's the societal issue there that we've got to deal with. But our regulations are pretty strict. And, the chamber, our job is to make sure that businesses are complying and protecting the public health. What I've been telling businesses is, I don't care what your company does, you're now in the health and public safety business too. And if you don't protect the public sector, if you don't give them confidence, you'll lose their business. And so we really are doing all that we can just to pump out every single day, follow the guidelines. We still have a shelter in place order here for senior citizens through June. And we just have a new hotspot that opened up yesterday. And so, it was in a business that was a poultry, Kevin, so similar to what you saw. So anyway, I do think following those guidelines are very important. We have a lot of businesses in Georgia that are licensed businesses. So the Cosmetology Board actually had a working group for about 2 weeks and laid out what their requirements were going to be, and then approved by the Department of Health and Human Services and the CDC. So there's a lot of business work, and Governor Kemp's been great about working with all the business sectors out there. But we don't want a lot of flexibility. We want people to be able to follow those rules. And we did a communication today with our local chambers and said, it's your responsibility to make sure your businesses are complying with these, because if not, as our governor said, we'll turn the dial back up and shut businesses back down if we can't control it. And so it's our job to keep the dial turned down.
I completely agree, Chris. And we've kind of here in Kentucky said, whatever it is that business needs to do to reopen as safely as possible, we will be there to help. And just in our area right now, we have about 400,000 masks that we are shipping out all across Kentucky to make sure that every business is equipped with the PPE they need to kind of reopen. But we do know, various size plants, it may be a little more difficult to do temperature testing or things like that. There's just some nuances that we're trying to work through. But I do think whatever we do, we want to make sure we're complying the best possible. And even in our recommendations that we submitted for industry-specific, kind of sector-specific recommendations for reopening, we asked the question, how are you going to convey these safety precautions to your customers and to your employees, because we as businesses have to make sure that customers and your employees feel safe coming back into these establishments. So that's on us to make sure that they feel safe. So that's a great answer. Bradley, how about you? I mean, oh yeah.
I was just going to add, I do think it's a long-term issue too, not just when the orders are lifted, but your businesses need to go and have a PPE supply chain set up. They need to be thinking about these things long-term, because we're already talking about, you know, re-emergence is coming in the next couple of months. And so just make sure that the businesses understand none of this is temporary.
Exactly. Yep. We're in it for probably the long haul. Bradley, how about you? When you kind of mentioned how you guys are reopening, what kind of requirements are kind of across the board for your businesses in Tennessee?
Sure. So Governor Lee has established what's called the Tennessee Pledge, and he is asking all businesses, whether you're deemed essential or they're authorizing you to open up, that you take the pledge to the best of your ability. That pledge was formed from his economic working group. He pointed to us and the NFIB here, and over the course of 3 days, we convened about 200 business leaders from across the state in 9 different subcommittees or categories for different businesses. They established best practices or recommended guidelines for these different industry sectors. We completed that and submitted that to the governor, and the governor largely here has taken all of those guidelines. The one thing that he has emphasized is these are not mandates, but similar to what Chris says, if it's in your best interest to make sure that you're able to implement these really to the best of your ability, because we cannot have a situation where we start back up and then have to go back into a stay-at-home order. I would say too, the wild card in all this, the numbers and kind of the data that we hear is about 70% of manufacturers are still running pretty much at capacity where they were. The other 30% have either slowed down their operations. Some of them have actually changed, and then only a handful have actually kind of ceased operations temporarily. The polling that we see also is that consumer confidence is going to play into so much of this, because restaurants really, their margins are at around 70% occupancy or capacity. Them being at 50%, they know this is kind of a stopgap measure for them to be able to operate and generate something. Consumer confidence, I saw a poll the other day that about 60% of all Americans still have concerns about going out to eat, doing different things. But as that progresses, that'll really be the key to economic recovery, and making sure that businesses do follow health and safety guidelines is vitally important.
Absolutely. Thanks, Bradley.
Actually,
how about you in Indiana?
Well, thank you. I was going to add on Bradley's point about the restaurants. We've had several restaurants who said that they're not going to open up during the period of 50% that they've got to, they're going to just wait until they can have 100%, and they'll make adjustments as far as spacing and distancing and all of that. We're the most manufacturing intensive state in the country. We have larger percentage of our employees working in manufacturing than any other place. And it's been a mixed bag. Some of them are going at full capacity or more. We've had the General Motors plant in Kokomo, Indiana, has switched over to they were shut down for a while, and then now they're making ventilators and learning to do that. We've had others that have had their production severely reduced. We've got auto manufacturing plants for Subaru, Toyota, GM, and Fiat Chrysler, and they've all been on shutdowns and have extended those shutdowns. And I think now they'll start to ramp up, but their demand has been hampered significantly depending on the types of industries. Our construction folks are, particularly with the weather getting better, they're pretty much in full swing. They have added safeguards as far as masks and distancing on job sites and things of that nature. But businesses are ready to open and get back to work, but they also want to do it very safely. We did a survey and got 1,400 respondents of business people all over the state. And it was literally 33% and 33% said they are ready to open tomorrow. And another that said, you know, when there's sufficient testing and when there's sufficient contact tracing. So the safety is on the minds of the business people. They want to keep their employees and their customers safe. And they know that they have to do that, particularly on the customer side, to be able to get back to some degree of normal.
Absolutely. And you make a very good point about the surveys, and we've been doing that here in Kentucky as well. And we surveyed our membership a couple of weeks ago before any kind of time frame was made available for business reopening. And basically businesses across the board said they need about 10 days to be able to reopen, to get the supply they need of PPE and get their employees back to work and all that. So we've been able to find some pretty useful information in terms of surveying our membership across the board and making sure they're ready for reopening. Keith, how are you up in Ohio? What kind of requirements? And actually, I will say I was looking at yours yesterday. I like how Ohio did it to where they do have minimum requirements that everyone has to meet in terms of safety for all employers across the board, but there's also best practices, which I think are really good as well. So tell us a little bit about kind of the requirements that businesses have to have before they can reopen in Ohio.
Yes, Ashley, and that's right. So for every one of our industry sectors, the requirements are a little bit different. You know, it's a little different from retail to general office to manufacturing and so forth. And as you pointed out, for each one of those sectors, there's a mandatory minimum requirement, and then there are some best practices. And our governor consulted closely with a group that an ad hoc group of CEOs from around the state that he put together specifically for this purpose to help determine the timetable and the protocols when businesses do return. So a lot of employer input into just what those protocols are and should be. And he did that similarly with a specific group of restaurateurs and hairstylists and barbers when working on the protocols that they're going to have to follow when they're allowed to open. But the protocols are, they're pretty straightforward, similar to what we've heard already. You know, everybody's got to practice physical distancing, 6 feet between customers, between employees, or you have to install barriers if that's not practical. You've got to stagger your arrivals and your breaks. You've got to make sure that employees perform daily symptom assessments. Now, there's not a mandatory taking of the temperature, but there is sort of a generic obligation on the part of employees to take a symptom assessment. Employers have to put hand sanitizers in high contact locations. So a lot of the things that are sort of practical. And for most employers at this point, it's not too problematic because if they've been operating under the essential business definition throughout, then most of them have done all of these things already. And so it's not a new burden. It's only new on those folks that haven't been able to operate up to this point in time. And we've been conveying the same message that many of my colleagues have said before, which is employers have a responsibility to make sure that they are doing this right. They are following the guidelines, because I think it's, as Kevin said, it's going to be the consumer who determines really when we get back to any degree of normalcy, whether business is open or not open, whatever the governor says or doesn't say. The reality is that until folks are confident that when they go somewhere and they patronize a business, that when they go there, they're going to be protected and safe, until there is that level of confidence, then it doesn't really matter what the protocols are if no one's coming there and they don't feel safe.
To emphasize Kevin's point, I was on a program, well, it's been a couple weeks ago now, and one of the speakers was the chairman of the St. Louis Federal Reserve Bank, and his analogy is he said people are not going to feel safe going back in the water until they know that there are no sharks, or at least they know where the sharks are. And I thought that summed it up pretty well.
Yeah. And we do have the chat function open for anyone participating. And I saw something a few minutes ago about people working from home, kind of like you said, some practical guidelines. We here at the Chamber, we have about 40 staff and almost everyone's working from home. We have a couple people here shipping masks the next couple of days to make sure those get out. But we are saying to businesses, if your employees can work from home and you've been able to function that way, they should still do that. So we do know that reopening is starting May 11th here in Kentucky. And so for professional services, people who have kind of office type of jobs, you can open at 50% capacity. But what we are saying is that really at this point, if you can work from home, you should still work from home. And that's what we're going to do here at the Chamber. So another question I kind of want to do a round robin in. And I have a 4-year-old and a 7-year-old at home. And so I am, in addition to working, I'm also homeschooling. And I know many of us have been juggling that. And yesterday we heard here in Kentucky that there's going to be a couple options maybe for reopening school here in Kentucky. One might be in July, a little earlier. One might be August normal, and then one might be post Labor Day, kind of later on. I think many of us know that we keep hearing about a spike of COVID in the fall. So starting earlier, you could get at least maybe a couple months of instruction under your belt. But I'm just curious of the other states. Have you guys discussed the future of education, how the reopening of schools looks like, and really childcare in general? Because here in Kentucky, we do not have an opening date for childcare. And as all of us know, kind of in the chamber world or in the business sector, that childcare really is, at this point, I think the greatest hindrance for people getting back to work. If you don't have people to take care of your children, then it's very hard to go to a job in many cases. So talk a little bit maybe about reopenings of schools and if childcare has reopened in your state. And Chris, I'll tee it up to you first.
Sure. So child care has been reopened with very strict guidelines, just like everything else around here. We've not had discussions yet about when schools will reopen. We know we're closed for this academic year. Our colleges announced yesterday that they would open for fall classes, although they are working through various models, which include staggered schedules, more online courses, limited gatherings on campus. Some have even talked about not opening dorms so that you can't, put kids in that situation. But all that remains to be seen. And so I think, what we've talked about, that's kind of the third phase of this, when society and education figures out how to operate in the new normal. So that will come over the next 6 to 7 weeks. Our General Assembly will reconvene on the 9th of June, talk about our budget as well as our COVID legislation, and then talk a little bit more at that time. So we're still in the investigating, part of this and letting local educators and superintendents figure out what models work for them. But we did have some of our schools actually, like my son's 13, he's still online courses until the end of May. We've already had some school systems in Georgia that have already closed up, and their last class will be tomorrow. And so it's, it's a lot of local guidance there.
Great. Thanks, Chris. Bradley, how about in Tennessee? What are you guys doing about schools and childcare?
Sure. Well, similar to Georgia, child care is continuing to operate, but they put very strict limits on them. I would say we are seeing where our higher ed institutions, they have been given the opportunity to individually decide what they want to do. My daughter is, enrolled or planning to go to the University of Tennessee, and they said that they are planning on having classes. I think Governor Lee here has made a commitment that he is going to follow the advice of healthcare professionals. And as the chamber, we have been in agreement with that and have certainly have deferred, because a lot of the guidelines and guidances, some of our folks were saying, no, that's pretty stringent, but overall they are very understanding. When you look at activities that have the absolute highest transmission rates, it is, I think, higher education is at the absolute top of the list, because there's interacting with, concert venues, sports events, bars, living close. Schools are very high as well. So we have not laid out exactly what we're going to do, but I suspect, especially around K-12, that there will be further delays. But I cannot tell you all the challenges that this causes. You all are right. Childcare, we hear that from a lot of our employers, that it's difficult for people to come to work if they don't have childcare. But I would say too, from an education standpoint, all of us are passionate about workforce development and education. This event, especially with Tennessee being a very rural area, a lot of the K-12 systems have not been able to adapt because, we don't have broad-based, internet or computers or things like that. So there has been, unfortunately, probably a slide for a lot of those students, and not having a plan is something long-term that all of us, I think, are going to have to face. As long as, in addition, we were talking the other day, all the fights we've had in the legislature, over the past 5 years, I think this is going to be an entirely, this will define a lot of our work moving forward. I'd say for the next, 5 to 10 years on so many issues that have come up, and there's going to be permanent changes from this. We're seeing it in the workforce, I think education, that's going to happen as well. So that's kind of where Tennessee is.
I think that kind of is a great segue that maybe Kevin and Keith, you guys can mention as well. Several mentioned that you have legislative sessions coming up. We just finished ours here in Kentucky, and there was a kind of a COVID-19 response bill that we actively worked on in the last couple of days of session to address many of this. But I do think Bradley's right. Going forward, there is going to be kind of, this is the path we're on, and most of our legislative policy, I'm sure, will center around COVID-19 recovery. And so in addition to maybe education and childcare, what are 1 or 2 legislative items that you all are looking at really from a chamber perspective on how to help with the COVID-19 recovery?
I would say for us, top of the list is liability or litigation protection for companies who do follow the guidelines against lawsuits saying, I got the virus in your business. And that's going to be very important. We also need to sort out, and there's already going to be litigation on business interruption policies and insurance policies. Most of those say the interruption has to be due to physical damage to your business, and so it doesn't cover pandemics. Some have specific provisions, but those policies are going to be tested in the courts, and obviously the vast majority of those policies were not underwritten to cover pandemics, and if the courts deem that they have to cover those, that'll wipe out some insurance companies. So there's a real battle and balance and trade-off that is going to take place. But our number one is the litigation, and then we're watching very carefully the impact of all this on our unemployment insurance trust fund. And one of the areas of investment with the federal relief funds that we're suggesting to our recovery task force is to perhaps put a chunk of that into our unemployment trust fund so that it doesn't go get down to zero, and then we have to borrow from the federal government and pay that money back with interest.
Right. And Keith, how about you in Ohio? What policy ideas are you guys thinking about for like COVID-19 recovery? I know you have, I think, a legislative session coming up.
Well, we're in a permanent 2-year legislative session, so never stop kind of environment, unlike some of you all, our neighbors to the south in Kentucky and to the west in Indiana. But our legislature was in March and did a little bit of a relief package at the end of March, a little bit more of a short-term, immediate concern kinds of things, like extending our tax filing deadline to July to mirror what the government did, and provided some extensions of regulatory compliance deadlines and permitting and things like that, but nothing really major. They just returned yesterday or Tuesday for the first time since the end of March. And our top priority, like Kevin mentioned in Indiana, is liability reform. So we've been working the last 2-3 weeks on some draft language that actually did get introduced as a bill yesterday, had its first hearing the same day, and we're hoping is going to be fast-tracked by the legislature that will provide the protections that employers need from the things that Kevin mentioned, and also for the employers who, in the manufacturing industry in particular, who shifted their production from whatever they normally produce to some sort of PPE, and whatever the liability that comes associated with producing those kinds of products. We want them sort of a good Samaritan law to protect them as they try to adjust to meet needs. So that's going to be top of the list. After that, it's really interesting because we're not entirely sure what the legislative solutions are going to be to assist employers at this time. I mean, the biggest concern that we are hearing, and I'm sure all of you are hearing, beyond liability, is just cash flow, right? We need capital, we need money. And I mean, I'm sure your states are the same as ours. Our state is their tax revenue came in $776 million below projections just for the month of April alone. And so the state's not going to be in a position, unlike the federal government, the state's not going to be in a position to do much to assist employers with some cash assistance. So beyond that, I'm not entirely sure. We have a bigger problem than Indiana does with our unemployment trust fund. We've been insolvent or near insolvent for close to 20 years, and our legislators dragged their feet on trying to fix it. We're going to be broke sometime in May. Our Department of Job and Family Services that runs the unemployment system here has already asked for the federal government for a loan, and have told the federal government that we probably, when it's all said and done, will need to be borrowing to cover benefits all the way through till early 2022 to the tune of $3.1 billion. That's the projection. And in comparison, that in the 2009 Great Recession, we borrowed $3.3 billion. So it's a huge problem, no easy solution. So those are some of the things. I guess the only other thing I'd mention is in the workforce space. For us, that was the number one concern of employers back before March 1st, was getting qualified workers for a variety of different skills and positions. And even though we've got over 1 million unemployed now, I think we're still going to have challenges as folks return to work and are trying to bring back or hire a new workforce. I think some of those workforce challenges will be acute but different. And employers are going to need access to training dollars and different types of assistance than they would have needed just a couple of months ago.
Great, thanks, Keith. Again, Kentucky is facing much of the same. It just came out this week that we will be about $500 million short in our budget, and we have about 30% of our population on unemployment insurance benefits. So a pretty deep hole to dig out of. So now I want to kind of shift to the second portion of our program today. Like I said at the beginning, so Jim from Brown-Forman. Brown-Forman is a company I don't think is a stranger to any Kentuckian, and I love the product placement, Jim, of the Woodford Reserve Derby model in the background. So I'm going to turn over to Jim at this point. He has a presentation, and I just think it's really important for us to learn from companies that do have a global footprint and who have kind of experienced this in other parts of the world, and how they kind of got back up and running and kept their employees safe, all while managing their products. So Jim's going to share his screen, and I'm going to turn it over to Jim to talk a little bit about Brown-Forman and how they've been able to keep going and make sure that safety is the top priority.
Well, thank you. Thank you very much, Ashley. So yeah, it's been an interesting ride for us and working through COVID-19. Brown-Forman, we got 40 products bottled in 12 different countries, 4,700 employees, and 1,200 of those in Louisville, Kentucky. And you may have heard some of our brands. You see the Woodford behind us, but that little brand called Jack Daniel's in Tennessee, and Old Forester, et cetera. I mean, we as a company were at the beginning of 2020, we're ready to celebrate our 150th year as a company. And a little thing came around called COVID-19 that kind of put the brakes on what we had to do, and then really focus where we were going and what we had to look at was going on in the East with our Hong Kong office, Seoul, Korea, in Tokyo, and start focusing on the health and safety of our associates there. And then really start thinking through the process of what we were thinking of the what ifs if this starts to come east to west, and what are we going to have to do to prepare as a company. So we as early on as February 4th of this year started thinking of what those tripwires may be, and if these tripwires get hit, what are some of our next actions. So what I'm showing you here is part of a presentation and training program that we're going to use with our office folks that will show what our global production teams have been doing to keep in business and to produce the quality products that we have coming out of Brown-Forman each and every day, and show how we kept our people healthy and very safe. in that process. So let me take you through a few slides of this. I mean, one of the first things obviously we did, we stopped travel, and then we sent our salaried folks home and really kept our focus on the global production side. The key way we were doing that was communicating change. We had created a crisis management brand for Brown-Forman called We Care. It had been out there for a while, and this was a perfect way to launch that out to our employees to show that we care about our people, we care about our consumers, our products, and obviously our finances, but our people and our consumers come first. So we established a website internally so that our folks knew exactly what we were doing, all those messages coming in from leadership, and how we were going to be communicating change. From that, we really started looking to say, what are the things that we were going to do from all over the globe in our operations, because in essence, we have at least around 22 different operations that we run in global production across the globe, mostly focused in North America and Europe. But you'll see these pictures there of things that we needed to do and start getting people's mindsets around what an arm's length conversation looked like and what social distancing really was. So we did some very interactive, what we called take-a-minutes, where we do this take 5 presentations for our salaried folks to be able to show them what our hourly associates have been doing and how they've been able to manage through social distancing and all the protections we have. And you'll see even the shirts that we put on folks, the Jack Daniel's shirts that on the front of them is that caution, stay back 6 feet, as a walking billboard, but a lot of signage around our plants and a lot of folks understanding in these interactive exercise what it really takes to be socially distanced 6 feet apart. Then we had to look at our office and our production plans to start looking at how we were going to do that and manage in the environments that we were in, to look at one-way traffic, and then starting to mark out, say, if we start staggering our breaks or start staggering people the way that they're coming in, maybe we have a group A that comes in and occupies this space, then when they leave, we have a group B. You know, what are our one-way traffic patterns, and how are we going to still manage that in conference rooms and social distance? So we've cut a lot of space out in order to do that, and we're looking forward to start getting some of our folks back and then start exercising this plan in a pilot that was laid out in the Healthy at Work Phase 1 reopening for May 11th. And you can see some of the pictures here, everything from our production sites, as well as what we're doing in our offices of directional signs, the barriers that we've had to put up in, or even around our spirit safes, that if you're inside of that, no one's to be in that area with you, to the barriers. You'll see that one yellow barrier there at Woodford Reserve, where these were areas that we had employees packing cases right there, and they're directly opposite of each other. So what can we do to protect their health and safety and still keep the product moving as our consumers are enjoying it in their time at home? So even conference room tables, everything's very, very visual, what we're doing. Here's some more examples of that with the signage, the one-way and X's on tables that say, sorry, you can't set here. You can set in a space where there is not an X. On the right-hand side of the page, you'll see the hand sanitizer example there. And one thing to be very mindful of is, as you put these provisions in place to protect your people and give them hand washing and sanitizer and all the things, because we've obviously been manufacturing hand sanitizer as well, but really getting down to who's going to refill that when it runs out. And so making sure that there's a management of change process so that we don't run out of things and people don't have an excuse of not to be able to use the sanitizer, and tell them at what point we want them to sanitize and really how often. So a few visual graphics there as well. In some staggering of our schedules, I mean, we've laid that out and how we've done that. Staggering work days and hours, avoiding peak times in transit in countries as we're starting to go back to work and start looking at what we're going to do in Hong Kong, one of our first offices to reopen, and then have them understand of the folks that can still work from home, that can do that still need the child care issues like you've been talking about, and have that and still need that. So they, there's folks that are still, doing a WebEx presentation or for Google Hangouts, or the folks who are going to travel into the office to avoid peak times of transit on mass transportation. Limiting occupancy, seating, and what we call our Results Anywhere program. So you can see a little bit how we've done that there. And then really big emphasis, obviously, on sanitation for our facilities and our global production facilities, with safe quality food that we're putting out and the whiskeys and the fine products that we're making. But, to look at what all of our increased cleaning regimens that needed to be done by our cleaning services, by our employees, and making sure that those are all available for everyone to be able to use. The hand sanitizer, but also, making sure that we've got soap and everything that we're needing there. All the personal protective equipment, and you're starting to see the masks that we had started being built internally for our employees at our Jack Daniel's cloth-based coverings, getting those out there for our folks. A tremendous amount of signage, working with our design teams to get these things out of there. But we started off at the beginning as, if you're a small business, with a lot of the CDC and World Health Organization signage and a lot of things that were out on the internet to put it out there before we designed our own. And then starting to look at whose responsibility was for the landlord and where we are in about 60 offices globally, and then what are the employee cleaning responsibilities as well. Moving on to that, and you can see a little bit more of that visible signage that we started to put together. And again, you can talk to people about it, and we can do these take a minutes and take fives, but having it visible for folks to see anywhere and everywhere. We proliferated it and make sure that we keep it updated. And we are actually auditing to make sure that those signs are still there, and looking to make sure that these things are really and truly ongoing. We also implemented health and temperature activities. On the temperature side, everywhere from employees taking each other's temperatures to every employee is required to take their temperature before they leave home. And then when they get to work, we either have what you'll see on the right-hand side, when you have, the large population of employees that we do at Jack Daniel's, we have them go by scanners that read literally within a second and tell a temperature. And an employee puts a sticker on that says that their temperature has been checked that day. And that way we can go peer to peer, that folks say, wait a minute, where's your sticker? Did it fall off, or did you not get your temperature taken? So we've laid out temperature self-service stations. Say if you get sick at work, you can go take it there. Or, if you didn't have your thermometer stop working at home, there's a couple different ways that we can do it. But we also included some of those things in making sure that folks understand that staying home was still okay. The telehealth, Brown-Forman's covering the deductible on that to make sure that folks can get the medical treatment they need. The EAP program for mental health, 14-day paid sick leave. So Brown-Forman really went out there to make sure that folks understood that they would be taken care of if in fact they did get sick. But again, the premise being, if you're coming to work, we want you to come to work and be healthy. And you can see some of the personal protective equipment there and some of the stations that we've set up to make sure that we have the PPE available, but also the training, the use, the inspection, the removal, how you reverse a glove off. And then enhanced hygiene and etiquette, making sure that, that when you cough or you're going to sneeze, what's that etiquette, what we expect of that, so that we can reduce the spread of disease from and to you both. Then we also looked at it from a working at home. We need to take care of our folks out there that are working from home, our salaried individuals or production individuals who are not coming in. And we looked at it and partnered with, some of our consultants, and making sure that we gave guidance on how to set up your home workstation ergonomically safe, as well as we also had some provisions for individuals to do stretching and gave them stretching breaks. So as the home office may be awkward of people that are not typically what we call results anywhere, that literally they had what they needed to stay safe at home. Last couple slides is what can I do? And we're laying that out there, what we expect of every single employee to do. And again, these signs are now coming into our offices globally as well. They're all over our global production, as well as we are very an inclusive environment and very collaborative in what we do. So we want our people to share their ideas and solutions and say, here's how we can make this better. Here's how we can feel safer, because engagement is extremely important at this time, that people feel safe and healthy at work. Lastly, some of the imperatives that we see, and really goes back to living our values of teamwork, respect, integrity, excellence, and really focusing in on making sure that we have those in play all the time and keep driving this We Care brand globally. And us, as we've had to kind of work through this, kind of forecasting what's going to be next and how we were going to have to deal with that. We looked at it from a governance standpoint. We have a fairly sizable crisis management team that's working on it, and we have incident management teams. But even as a small business, you can have a couple people together trying to say, how do we deal with this from a governance standpoint, and start setting up those tripwires, and how are we making sure we're continually communicating with our employees to what our next actions are from those tripwires. I think a really important point that we've learned out of this is the word agility that our CEO uses, and that what we would have is a document together one day, put it in play, and the next day it would change based on what was going on out there. Lastly, a couple things is normalcy. What we tried to also do was establish normalcy where we had safety processes before, but now let's focus those on going out and auditing and making sure that we're doing all the stuff that focused on the health side of this. Let's stop that for a moment and bring this in on the social distancing. In the bourbon industry, we've certainly done a lot of benchmarking with each other and making sure that we're learning from each other so we're not reinventing the wheel, and I encourage everybody to do that within your industry. And then lastly, I mean, I've mentioned engagement, but really community and living our values. And we've done so much internally for our people, but we've also reached out in our community to help give hand sanitizer out to the community and to emergency management agencies. We've served over 50,000 meals to our local community and kept people engaged that may have been, furloughed or potentially laid off. And then, donations to One Louisville, donations to the hospitality industry. So we've tried to, live our values, and I think that's a very important point to leave on, is having those values and living those values through a turbulent time is so ultimately important.
Wow, Jim, that was fantastic. I was taking notes even here. I had not even thought about who changes the hand sanitizer. And we got cut off. Darn it. Oh, I thought we got cut off. Sorry. My computer just went blank. But no, thank you for that presentation. That was wonderful. I think it gave really practical advice for many of us to follow. And so I hope that people will pay attention to what Brown-Forman is doing and use some of those very practical suggestions while we start to reopen here in Kentucky to make sure that safety is our priority. The Stay 6 Feet Away shirt was probably my favorite part. I love that. Our friends from other states that are watching, and obviously my counterparts from other state chambers, one of the coolest things to come out of all of this new way that we're living is that we're very fortunate to be the bourbon state. And so our distilleries have an abundance of alcohol, which can also be turned into hand sanitizer. So it's been a really cool partnership that the Chamber has had with the Distillers Association here in Kentucky. And so if anyone needs any hand sanitizer in Kentucky, kyhandsanitizer.com, you can order them. I've joked recently, I probably need to take a couple bottles down to the Historical Society here in Frankfurt, because I think in many years, it's going to be pretty cool to see a bourbon bottle with hand sanitizer from the year 2020. But that's just another way that we're trying to partner together and keep businesses as safe as possible. We have masks here at the Chamber. Go to our website if you need any masks. We'll probably be doing this for a couple more weeks. Again, just trying to get business whatever they need to be as safe as possible and to keep everyone in Kentucky as safe as possible. I want to thank everyone. This was a great conversation. I was really looking forward to it. I love kind of learning and listening about what other states are doing, and I think it's important to kind of share this information as we go along, especially with our border states. And then having, a great corporate citizen like Brown-Forman that means so much to Kentucky, really leading the way, I think, in terms of making sure that we keep everyone safe and getting them back to work is really important. So thank you all. And just a reminder for everyone participating, we do record these. And so these will be on our website here shortly as well. Next week, We have a couple other really good ones, one dealing on tourism. I think a lot of us are wondering, it's about summertime. What are we going to do this summer in terms of tourism and kind of having fun? And so we have several tourism experts from around Kentucky joining us. And then we also have a session on local governments and how COVID-19 has affected our local governments. And we have mayors. I know Lexington Mayor Linda Gorton will be joining us as well. And then this past week, or actually just a couple days ago, we had a great session with several attorneys on legal liability. That was mentioned several times on this webinar. As we all start to reopen, we want to do it in the safest way possible and be as knowledgeable as possible and educated as possible as we do this. So lots of great resources. Check out our website for anything you all need. And I think it's about time to close up. So I just want to thank you all, especially for taking time out of your day to spend an hour with us and help us learn a little bit more as we all navigate this new reality in which we're living. And I'm thankful for all of our partnerships, and we look forward to staying safe with you all and seeing you all soon. So thank you all. Have a great day.
Thanks for the opportunity. Bye-bye.
Thank you.